we understand this, and I've seen it in small groups and silos of people doing it where they're trying to incorporate all this understanding. It's all part of the healing process. Others are still going more into specialization, right? Deeper and deeper into a singular thing where it's just the stem cell therapy, right? It's
Right.
just the specific type of psycho-emotional treatment. Do you are you seeing the trend at least that more people are starting to accept that an integrative approach that really embodies all these facets is the best way to move forward?
That has to be. I think
Has to be.
our population is becoming more educated. Social media, and sometimes positive, many times not so positive, but at least it's opening up people's minds that there may be another way of doing things. Even on a routine news media of NBC, CBS, occasionally you'll see somebody on there who talks about doing breathing, or they
Yeah.
come on and they're doing yoga exercises and that type of thing per se. So people in tiny ways are definitely being exposed to this. Unfortunately, I don't know how recent the study is, but there was 20 years ago, there was a study that asked, do you use any form of alternative medicine? And this is one of the, I mean, it's at least 20 years ago. And, surprisingly, like 75% of people said yes. I said, whoa, that's not possible. Then they said, well, what do you do? And like 90% of the answers, I get a massage. That was their approach. That's what they thought was alternative medicine, was to get a
That's
massage.
Cam, right? Yeah.
Yeah. It's like, okay, that's not exactly what we're talking about with alternative therapy,
Right.
alternative medicine. But it's much higher than that now, because yes, people are much more understanding that energy in healing, definitely has to be the way to go. Because what we're also saying is, we'll say we're in 100 years of pharmaceutical medicine. So now people have watched their parents and grandparents live through that and not really have the greatest quality of life, and say, crap. It's like,
Yeah.
what's going to happen to me? How do I mitigate, or how do I prevent myself from doing that? And I use my own wife as saying she watched her mother suffer greatly with rheumatoid arthritis, and deteriorate greatly, and said, sure as heck don't want to do what that does. So I think I'm not going to do what she did,
Yeah.
per se, which was just believe the doctor and say, well, you have to take this and this is how you treat it. And per se, it said, no, there's other ways of managing your health than just listening to the doctor and taking a medication. So the generations are such, and we're getting more and more parents who are becoming aware that raising their children the way they were raised probably wasn't the best thing. So the new generations are starting to, raise their children with a higher level of awareness that we don't have to rush to the doctor every time we get a cold or a flu or, a fever, and we can use natural therapies. We can actually take an herbal medicine or a homeopathic, or use what I was exposed to is if you had a fever, you get in the bathtub, and it's like
Right.
70, if you had a cough, we needed a mustard plaster. And if you had the
Hmm.
GI upset, you did castor oil packs. And it's like,
Right.
that's what I grew up with. And so I feel fortunate that, I wasn't exposed to the world, because my parents were quite poor. They couldn't afford to take me to a doctor. And thankfully, that was actually a real godsend
Yeah.
because I wasn't exposed to that type of medicine and never had to take those types of things. So I learned the approach of biological medicine, as a little kid,
Yeah.
in general. And more parents are raising their children with that kind of awareness. And obviously, there's many, even whether it's a functional medicine doctor or a naturopathic doctor or a biological medicine doctor, more and more people are becoming aware of that. And so, step by step, person by person, one person at a time, if we need to. And more, as you said, the biohacking people, instead of the drug, they want the machine. It's that the machine isn't going to cure you. You're still going to have to do something yourself. You're still going to have to approach your health care as self care,
Right.
before the healthcare system. Doctors are incredibly well trained. They're brilliant people who are there to help you, and they practice what their training is. I have many medical doctors who are my patients, because they realize their own system doesn't really work very good. They
Sure.
do it
Sure.
because that's what they learn, but they're looking for their own health outside of the box,
Yeah.
in general.
So many have already experienced it in their lifetimes, this failed experiment of, we need more drugs and more research into these sort of things that aren't working, right? We spent billions and billions on this war against cancer, and what's happened? We have more cancer than ever, really. We could
Right.
say our lifetime expectancy, even though it has gone down, we're living longer because of these treatments, because of vaccine, everything else. But the truth is, our quality of life is worse than ever, and people are actually experiencing it. They don't even care about the data so much because the data is
Yeah.
always showing something good when we're getting worse and worse. So it's kind of, you
100%.
have to question these things. And I think a lot of people are starting to have these very tough, conversations in their head. Was I wrong? And that's very tough.